Today we shall talk about case taking. I think this is probably the most important subject in homeopathy, which determines the success or failure in that given case. So let's give it all the attention we can, and I will share with you some experiences and some techniques of case taking. The first question is there a standard way of case taking? Many students and even teachers who are interested or who are practicing the sensation method feel that there is a standard way of case taking, which is you take the chief complaint, you just stay with it and keep on probing the experience in relation to that complaint. So then you pass through levels of name, fact, feeling, delusion until you come to the sensation, which is level 5. And then you try to keep on refining it, making it clear and clearer what the exact experience is. And that experience will then show itself to be an experience from one of the kingdoms of nature, mineral, plant or animal. It will be either structure, sensitivity or survival. And then you go on to the sub-kingdom and to the source. You use the hand gestures because they are more important, they show the energy pattern, and your hand gesture can be your way, your route, your door to the sensation. This is where the homeopathic profession sees the difference between the sensation method homeopath and the regular or classical homeopath, because regular or classical homeopath is more interested in finding out the facts, which means the symptoms, the modalities, the locations, local sensations, objective features of the mind, for example, mild disposition of the patient, weeping, loquacity, irritability, anger, and sometimes causative factors like injury or ailments from grief. So he is collecting information, and through the set of information he comes to the characteristic symptoms of the patient and finds a remedy through the repertory or through the Materia Medica. Whereas a sensation method homeopath takes the patient right away to his experience and doesn't give too much importance to the symptoms and to the rubrics. This is what is commonly believed. And often the newcomer is in a kind of dilemma as to what kind of case taking one needs to do with the patient. Do I pursue the symptoms or do I pursue the sensation? And he feels compelled to decide at that point, am I going the sensation way or am I going the symptom way with traditional case taking? However, for me, both these apparently discrete approaches are seamlessly integrated, one into the other, each one complementing the other. For me, they cannot be separated. One must have all of one's basics in the first place right, and then with this we move further into the case taking using any variety of techniques that are available to understand the core and the totality of the person in front of us. Once we know what is our basic, what we are looking for, what we are treating in that patient, then it does not matter what technique you use. So let's understand what are the basic requisites of case taking. Case taking begins even before the patient actually comes into the clinic. It begins when they take an appointment. It begins when they fill up the case taking or the questionnaire form. It is very important to have the fundamentals of solid facts in the case. This is very important thing in the case. We must have the ground, and then we can go to abstract realms like the subjective experience or the sensation. I do not see this as one versus the other, either or. I see them always together. We must have in every case the solid ground facts. And I think we need this kind of solidity before we jump on to abstractions. I want to talk a little bit more about the use of the questionnaire form. I use the questionnaire form to actually have that solidity, to have the foundation in hard fact. I give it to the patient when they take an appointment, and they have at least a week, 2 weeks, 3 weeks to fill it out, and they have to bring it with them when they come to see me. This questionnaire form is more than 30 pages long, and it begins with personal data like the person's name, age, marital status, address, phone numbers, who he was referred by, etc. And then it goes to the details of the past history, the family history, the milestones, the etiological factors, the general symptoms, the cravings, the sweating, the hormonal patterns, the various modalities, and then it ends with the mind symptoms, sleep and dreams. This kind of questionnaire form is extremely useful, and I would like to recommend it to all of you. First of all, it gives all this information, and you don't have to spend the precious time of your consultation in eliciting factual details which are sometimes very important. For example, it covers in a systematic manner the physical generals and other aspects of the patient's case that are significant, such as past history, habits, whether he drinks, he smokes, how much, all the different milestones like walking, talking, teething, the sleep, the quality of the sleep, the position during sleep, the actions during sleep, walking during sleep, jerking during sleep, snoring during sleep, talking during sleep. Several things about his vaccinations, his trauma, his surgeries, the medications taken, emotional etiological factors like grief, upheavals, etc. So when you give them the form and they fill it out, it's a kind of insurance that you don't miss out anything, that you have all the facts in front of you before you jump into the abstract, into the subjective. Second, the second advantage of a case form is that the patient doesn't have to come to the clinic and then jog his memory. So he can think about the things, he can consult his relatives, his parents if need be, and get the information prior to coming. Thirdly, it prepares the patient for a homeopathic consultation and makes him aware of the kind of detail that we will need in order to treat him. Fourthly, the way he fills out that case record form gives a clue about his nature, about his character, about his handwriting, about the way he has filled it up. Has he been serious? Has he been lax? How has he done it? It gives a very strong impression about who you are treating. I mean, for example, some people do it very carelessly. Some people do it in a hurry. Some people do it in the last minute. Some people don't do it at all. They just come with a blank form. And some people are so careful that they write the whole form in pencil and then they make it fair with a pen. That kind of nature, immediately you get an impression. Some people fill it up so completely, it's crowded. And some people write so neatly, it's like print. And also how they express is really a very, very good clue to the patient even before the consultation begins. Sometimes the patients are more comfortable to express themselves in writing rather than orally, and here they sometimes feel less inhibited. For these reasons, I have made the questionnaire form mandatory in my practice. Participants of this course who want to view or download this form can download it from the link from my clinic www.sankaransclinic.com/clinic F8HTM. I repeat, www.sankaransclinic.com/clinic CLININ F8.htm. I will send this link in the mail so you can have it. I think it's also on the forum, this questionnaire form. Have a look. The download is without any copyright and you can download it for free, copy it, use it in your practice. Sometimes I even ask the patient to go to this link, download it from there and fill it out and bring it to the consultation. This form is also translated into German. When the patient comes with the case form, I have a quick look at it. It looks like this a little bit. Okay, so I have a quick look at it. I just glance through it and I see what he has written. I read it. So it's like a scan. I scan the entire life of the patient through this case form, and I can pick out from there what is striking, what is different, what is standing out and in different areas of his case, and I use this for inquiry later on if necessary. Very often when somebody in homeopathy is asked what is the purpose of case taking, they often say the purpose of case taking is to find the remedy. But I think this is only one of the purposes of case taking. There are so many other verbal and non-verbal advantages to case taking. But the one I want to emphasize is one that is highly neglected in homeopathy, I feel, and that is diagnosis. I feel that our purpose of case taking should also have a diagnostic element in it. We need to know what is the pathology the patient is having. And why is this important? Because only when we know the pathology, we can know what is the peculiar or the individualizing symptoms of the patient. Because what you think is peculiar may be completely common to that pathology and the other way around. Secondly, many remedies are known for that diagnostic label, and this can give valuable clues. If the remedy goes through and through the name level, which is diagnosis, fact, feeling, delusion and sensation, and the pathology, then you have hit jackpot. For example, bryonia with its aggravation from least motion, from coughing or sneezing, is a well-known remedy for pleurisy, which has exactly that symptom. Therefore, the diagnosis, if the remedy has that pathology in it, is an additional point even though it is not mandatory. Thirdly, sometimes the pathology itself is so peculiar that you need to consider that remedy for that specific pathology. For example, a patient has no other complaint but a huge lipoma. If you are able to diagnose that lipoma, you might think of a remedy that is specific to it called lapis alba and even examine if the patient's state is lapis alba. For me, that's a valuable clue. I don't discount it at all. I would like to examine if lapis alba could be a remedy without any prejudice. I'll give you an example. Last week, I had in my clinic a ear, nose, throat surgeon, Dr. Melgiri, a very senior specialist who is deeply interested in homeopathy, and he actually gives homeopathic remedies for so many years now. He pointed out to me a peculiar symptom of staphysagria, which you can look up even in Fatak's Materia Medica, and that symptom is vertigo, in which the patient must spin on his heel or walk in a circle. Now let us try to understand. The symptom is the patient who is already feeling giddy feels better by spinning in a circle or walking in a circle. This is extremely peculiar. So the doctor was very curious about this symptom, and then he examined the medical books and found out an exact diagnosis for which this symptom is the indicator, and that is called valvular epilepsy. And he found out that valvular epilepsy is such a condition where the patient experiences vertigo and is forced to walk around in circles during the episode. So, if you get a patient of valvular epilepsy, should we not consider staphysagria as a possible remedy? Diagnosis also gives a clue to the miasm. Of course, miasm is a classification of the state and not of the pathology, this is for sure. But when a person has a destructive pathology, especially at a young age, one would think of a destructive miasm. If a person has a fixed pathology or he has warts or tumors that are benign, one would consider the psychotic miasm. Finally, a diagnosis is very important in order to investigate the case, in order to evaluate the progress of the case. If you don't know the diagnosis, how do you know what's happening? And this is also very important for the validation of homeopathy as a scientific system of medicine, and this is where we sometimes lack. We don't validate it, we just treat the symptoms, we don't know what's happening, and then we don't have any results to show or any validated and proven result. And I think this is an area we should get sharper in. So my sincere suggestion to everyone is to diagnose. Know what you are treating. Any symptom the patient says, don't just take it as a symptom, also take it as a diagnostic clue. Don't just say joint pains. I treated a case of joint pains. What is it? Is it rheumatoid arthritis? Is it an autoimmune condition? Is it a tubercular arthritis? What is it? Is it osteoarthritis? So you should know what it is exactly. Or is it gout? And often, if I myself am not able to diagnose, then I do send the patient for investigations, or in some cases even to consultation with a specialist, and I try to be very clear what pathology is going on. So we'll come back to case taking. The first thing about case taking is observation. So one I told you is the use of the case form, which is also an observation what's happening over there, and it's a scan. It's very, very useful. Then the patient walks in with this form, and then you see how the patient sits, how he walks, how he talks, with whom does he come in, how does he respond to the questions that are asked, how expressive, how reserved, how decisive, how hesitant, how aggressive, how mild, how is he, how sensitive, how communicative, how friendly. Similarly, observation about the physical things. What is the color of his tongue? How is his skin? Are there warts? How are his nails? Things that you can observe about him. How is his body built? And just the way the patient is, I think this is the most important impression. The impression that you get of the patient is really the foundation of your further case taking. And I can't emphasize this enough. I'm just talking to you and telling you how exactly I take a case, how I do it, and how I register the impressions of what the patient is expressing. I'll give you an example. Once I was taken to visit a religious guru. He was at the head of his religious institution in a powerful position, and he had a very commanding presence. His body posture itself was quite commanding. I was taken in his presence, and there were people standing around there, and I was sitting in front of him, and I had to take the history. Actually, his main problem was severe constipation. And what I observed is that any question I would ask, he would answer it with a counter question. For example, if I asked him, what are the things you like in food and drink? He would say, can a yogi have any cravings? Does a yogi differentiate between one thing and the other? Does the yogi not see everything as the same? These kind of rhetorical questions is what he would, any question you ask, he would give you an answer in a question. And this kind of position of his, this attitude, this command, the way he spoke, and the exact symptom from the repertory, questions, speaks continually in. He spoke only in questions. And the remedies aurum metallicum, which helped him. Actually, his talk reminded me of a very well-known former Indian Prime Minister who would always answer in questions. Once a reporter got exasperated with him and he said, Mr. Prime Minister, why do you always answer a question with a question? And he said, why not? One thing that you observe is the person's characteristic behavior. This is paramount. Sometimes we hear what the patient says without actually seeing who the patient is. This is where we make a mistake. I want to give you a case example. Today I saw a follow-up, and this is a woman who used to get headaches that were really terrible headaches. They are almost the worst kind of headaches I have seen in my entire practice. She is about 35 or 40 years old, and she is a secretary to the boss of a construction company. She is married, and she has a child. When I asked her about her headache, she would describe the character of the headache, or she would describe the stress factors that caused the headache. It could be anger, it could be grief, it could be irritation, and I would listen to her and give her a remedy based on what I listened, and none of the remedies worked. I gave her 2 or 3, and at that time we had a workshop coming up where there were homeopaths from all over the world, and I was to do live cases with them for 2 weeks. And I took this woman as my one of the live cases, as it was a challenge. And what I did here was I just sat back and observed who is she really. First is what she says, and second is who is she. And one thing that came to my observation, she is very loud. Very loud. She has a loud and a shrill voice. She also said that during the headache, if anybody came to her with any problem or anything, she would just scream. So it is this loud, shrill screaming. That was her essential nature, a part of it. This loudness and this screaming was also quite undignified. It had a kind of shameless quality. Even the way she described or the way she spoke was so loud. Normally, when a woman is irritated, she does not show it when she is at workplace or this or that. They don't show it so much, so loudly. But even in my office, she was so very loud with a kind of shamelessness. She could also speak about sexuality in the same kind of shameless way. For example, she would say, I dream of having sex with other men. Even though I love my husband, I have dreams, doctor, of having sex with other men. Usually, people mention these dreams in a kind of subtle way. Like a woman might say with a little bit of embarrassment, you know, sometimes I have dreams that kind of involve other men. But no, she was direct, blunt, loud. This was my observation. In the previous history taking, I had not given importance to observation. I was a bit lost in her description of the headache, or in the description of her stress, or in the description of her situations. I actually got lost in the trees and I missed the forest. But this observation about who she is has to be an integral part of her sensation. And when we probed this case, went on and on, it turned out to be a case of an insect remedy. And insects have this quality: loud, shrieking, shameless, undignified, even a shameless kind of sexuality like you see in Cantharis, like you see in Apis. In the Organon, Hahnemann mentions in the aphorism 153, he says, in this search, for a homeopathic specific remedy, that is to say, in this comparison of the collective symptoms of the natural disease with the list of symptoms of known medicine, the most striking, singular, uncommon and peculiar signs and symptoms of the case of disease are chiefly and most solely to be kept in view. The word striking is important here. What does striking mean? Striking means that which strikes, that which kind of slaps you on your face. It must have that kind of intensity. But sometimes I have seen myself and other people, we take symptoms that are not so striking. For example, the patient is described as a friendly person. We take friendly as a symptom. Or we take shy as a symptom, or fearful as a symptom. The description of the patient may be, oh, she is very friendly, and we say, oh, this could be phosphorus. This does not work. It cannot be lukewarm like that. For a symptom to be important, it should slap you on your face. You should say, what? This is so strange. For that, it has to have an intensity. It has to have a strangeness. It has to have an individual quality. And we have to probe till we come to that kind of quality. We simply can't prescribe on shy, bashful, friendly. It does not work. Another part of case taking is to inquire about the patient from his relatives or acquaintances who can give objective information about the patient's physical symptoms as well as mental attributes. They can provide information about his habits, his life story, etiological factors, childhood history, relationships, behavior, etc. Sometimes the patient can hide the facts or represent them in a totally different manner, and this can be corrected by inquiring from the relatives and acquaintances. Of course, it's very important when you do this that you shouldn't take the opinion of the relative but the observation of the relative. You cannot take, for example, the parent says about the child is very obstinate. It doesn't work. You have to say, what do you mean by obstinate? What is the exact behavior pattern that you have observed? That makes a difference. I want to highlight several things which we sometimes tend to neglect, and that is why I am going to focus in this talk especially on things we forgot rather than things that we do. Okay, so one of the things is the systematic inquiry into symptoms. We should never underestimate the importance of location, sensation, modality and concomitant of every single local symptom. It is important to understand the local totality before moving into the case. We have to really look into the finest details of the symptoms to elicit their peculiar nature. Sometimes symptoms are peculiar in themselves. Sometimes even the absence of an expected symptom is peculiar. For example, I have seen a case with Dr. S.R. Phatak where the air steward had eruptions from the head to the foot, and we gave him all remedies, and when Phatak asked him, what is your problem? He said, I don't have a problem, I just have eruptions. And Phatak said, what about itching? He said, no, I don't get any itching. And that was the symptom, eruptions without itching. And he got cured with the remedy Sikuta, which is one of the remedies for that. So, peculiarity, the strangeness, we have to look into the finest detail of what is strange here. You find peculiarities everywhere, in the appetite, in the cravings, in the aversions, in the perspiration, in the sleep position, in the etiology, and we have to go into the finest details to elicit these peculiar symptoms, and very often they form very useful clues towards the remedy. I tell you one thing, if we elicit the peculiar symptoms from every aspect of the case, even if you completely forget the kingdoms and the miasms and the systems and the sensations, you will still be successful in a very good number of patients. And that's what has kept homeopathy successful for all these years. So we should never ever neglect this aspect. And I think if we build on this, then we'll have a really firm, solid footing. One of the very important things is the modality. You have to elicit the exact modalities of that particular symptom, and then we will get the peculiarity. What we have to understand is the most characteristic things about the patient, and it may be found anywhere, local, general, anywhere. But we have to get that which is peculiar, that which is striking. I will give you a case example. Last week I had a girl patient who had a fracture in her tibia 5 years earlier. She is about 23 or 24 years old now, and after the fracture they put a rod in, and then the fracture healed. They did many scans and there was no problem with the bone afterwards. But now, since that time, she has had a swelling at that site of the fracture, and she still has that swelling, and that swelling is very tender and painful. When I tried to feel that swelling, it was very tender, she couldn't bear the touch. And it's so painful that she needs 3 or 4 painkillers a day and night since so many years, and they cannot understand why this pain is, what's the reason for it. So all they can do is give her painkillers. She says, I can hardly sleep because of the pain. Many years my sleep is disturbed. So I asked her, tell me, what is the type of pain? She couldn't describe it. She said, well, it's very tender, very painful, but I couldn't get her to describe the exact sensation. Then I asked her to describe what makes the pain better or worse. And here she said, nowadays, even in summer, my pains are more. I said, what do you mean? She said, for sure, my pains are much worse in cold and damp. And if I take my feet and I put it on the cold or damp floor, for sure my pain will aggravate. Now, I had her case form there, and I scanned it, and I saw that there is no other area where she has a problem, or even if she has, it's lukewarm. You know, every human has some problems at emotional level, at some, there are stresses and tensions in everybody's life, and at the age of 23 or 24, they are surely there. But there was nothing excessive in her case form that I could pick up and say this is characteristic, this is important, this is striking, this is strange. I tried to ask, do you have any stress? She said, well, you know, not so much. Anything at all? No. Now, what do you do?